the life sciences and healthcare industry, disruption from all angles is pushing the boundaries of what's possible today and what the industry could look like tomorrow. These trends bring new risks with them from a digital, ecosystem, and organizational standpoint. What steps can companies start taking today to embrace innovation and succeed in this new future? Welcome back to Tales of Transformation. Today, Omri Junadeen and Simon Gisby, both principals in the advisory practice, are joining me to kick off Season 4 as we explore the risks and opportunities tied to the future of health. Welcome, gentlemen.
Well, thank you so much.
Omri, let's start with you. What are some key drivers of change happening in the life sciences and healthcare industry today?
First of all, thank you for having Simon and me on this program. I'm really excited to be a part of it and talk about the incredible amounts of change in the industry that we both love and the industry that impacts so many people across this country and globally. There are so many drivers of change that we see. The first one is really around the advances that are being made in the adoption of emerging technologies and medical innovation. And this happens both domestically here in the United States and overseas as well, with access to expanded sets of data, and which really makes it possible for enhanced offerings to patients, or what we call consumers now, and ultimately an improved level of experience. In the United States, for example, right, we spend about 18% of our gross domestic product on healthcare and related items. And there's clearly a recognition that the level of the quality and the efficacy of healthcare delivery clearly does not equate to the amount of money that we spend. And therefore, we need to really do something very different to improve the quality of healthcare. So when I talk about emerging technologies, virtual healthcare related technologies is just one example how advanced technologies can really change the face of healthcare. The second one I want to talk about is around demographic change. We clearly are facing an issue with an aging population, increasing chronic diseases, evolving needs of the various generations that we are dealing with. And last but not least, the changing expectations of what we call an empowered set of consumers who have access to digital platforms and information that empowers them to actually make decisions about their own healthcare. And the final driver that is around the changes in the industry dynamics themselves, such as the emergence of what we call the orthogonals into the marketplace. These are non-traditional players that have entered or entering the healthcare marketplace to disrupt it, because there is clearly a notion that healthcare delivery needs to be disrupted. And also, listen, we talked about rising costs and the pressure that we have on our own government and private sector entities to reduce costs would really result in broad-based industry dynamic that is calling for this change as well.
Simon, have we left anything out, or I should say, has Omri left anything out? Are there other drivers that life sciences and healthcare companies should be monitoring during this transformative time?
Omri mentioned that today in the U.S., we spend 18% of GDP on healthcare. Health economists have predicted that could go as high as 25%. And one of the factors to consider is the political will to think about a quarter of the GDP being consumed by healthcare, and a question around value, because by some objective measures, mortality rates have stabilized, if not actually declined. So there's a political factor to consider, and how the government is, their healthcare policies, and whether they're going to be willing to spend this increased amount with question marks about outcomes. Another one is regulatory. Omri mentioned that a big key driver of this is around data, access to data, analyzing data, using data to affect improving healthcare outcomes. Very interesting regulatory question. Who owns the data? Who has access to it? How is it secure? How is it made private? And how that data can be used to guide regulations to make sure that quality is maintained and or improved. So a couple of those big macro factors that I think the life science and healthcare ecosystem need to consider around this transformative change.
Omri, emerging risks, what are the other things that companies need to be looking out for?
The first one I'll talk about is digital, right? Along with it comes some risk. How do we figure out how this data gets handled and protected? Who accesses it? Does this data basically comply with various privacy regulations, etc.? And then we also have in the digital world algorithms that are created that basically might even be in the business of making decisions. So how do we ensure that those algorithms that have been created for good basically are doing the right kinds of things so that the right kinds of decisions get made? And then finally, on the topic of digital, the complexity of cyber. We know that the healthcare ecosystem carries one of the highest risks from a cyber perspective. Number one, due to the intrinsic value of the data that we have in the healthcare environment, and also because of the relative immaturity of IT environments in healthcare. And therefore, we want to make sure that from a digital perspective, all of these complex cyber protection issues are taken care of.
Yeah, I just follow up with that. Look, I totally agree. And the concern is the classic garbage in, garbage out when it comes to data and data analytics. But the opportunity is, if we can find the right data and find the right algorithm, we can get ahead of disease. We can get ahead of a healthcare condition. We can anticipate an event. So the opportunity is to look for those correlations, to move from health to wellness and get ahead of the curve and start standardizing treatment protocols. The risk, obviously, is it the appropriate data? Is it being analyzed appropriately? And is it being appropriately secured?
The second thing I'll talk about is around the ecosystem risk. As we talked about, so digital cascades. At the same time, the healthcare environments, whether it's a supply chain or the various different players that you work with, or the regulatory environment that Simon talked about, all of these have kind of created, on the one hand, incredible opportunity, but at the same time, a lot of risk as well. So if you look at the extended network that a healthcare company operates in and deals with, and the handoffs that take place between the various players in kind of the supply chain, the accountability for risk management activities needs to be properly coordinated, right? So that the integrity of the process and the systems and the supply chain is maintained. Earlier, Simon referenced the regulatory framework. In an evolving healthcare model, the regulatory framework will need to kind of shift to keep up with these changes. So, for example, security requirements for virtual care, or the payment models that will be used will be very different. So the regulators need to really catch up with this, right? So there are a myriad of things from an ecosystem perspective that organizations need to be aware of and be highly cognizant of as they enter the new world of healthcare.
With all of these simultaneous shifts taking place in the industry, there is a tremendous amount of opportunity for organizations. How do they manage the risk that's involved with these simultaneous shifts?
That's a great question, because oftentimes when there's an abundance of opportunity, there's a race for the solution, so to speak, right? Without necessarily considering a specific approach to managing risk. So in light of this, we propose a three-pronged strategy that calls for a risk management framework to be integrated, intelligent, and innovative. So let me start with what I mean by being integrated. It's really about increasing agility and reducing costs by adopting a risk management framework or an approach that is integrated. Because as we've talked about, there are so many players in this ecosystem that we are talking about. So it's extraordinarily important that we have a risk management approach that is integrated.
I think you're spot on, because as we think about the future, we can no longer exist in an environment where one organization treats health, provides care. Another organization pays for it. A third organization sells a product. A fourth organization sells a drug. By using data and thinking about this integrated approach, we've now got to all collaboratively work together to say, is the drug appropriate? Is there a better solution? How can we provide care in a different setting? How can we tie the payment to an outcome and using data appropriately? So I think organizations have to look at that and say, how do we think about that new integrated ecosystem? What are the risks that could bring to my own business model? And how do I manage those risks to flip it around and say, how can I take advantage of the opportunities by bringing an integrated, holistic approach to healthcare?
Wonderful. And the second prong that I referenced was intelligent. What I mean by that is to enhance quality, improve efficiency, and increase accuracy by leveraging the myriad of digital technologies and data to identify and manage risks. There are tools and techniques that are abundant out there, right, to make sure that you're using the platforms available to synthesize data, analyze it, and make the best risk management decisions.
Yeah, I always think of the headline, "We can treat cancer before you've got it." How do we use data and digital technologies to manage and get ahead of those risks? And how do we then make throughout the system so it's an open source? So every participant can have access to the best data, the best outcomes, which would have just a transformational and fundamentally very profound impact on all our lives. If we could do that effectively, it would just have wonderful impact on outcomes.
And that really very nicely leads into the third prong, which is being innovative, right? Again, we talked about having an integrated risk management approach, but it also means transforming the traditional organizational approach to risk management by really adding a lot more value, seeing the problem differently, right? By using novel and value-generating approaches, quite frankly, to make the organization a lot more risk intelligent by being innovative.
Yeah, I agree, and I think of innovation in two ways. One is innovation in terms of thinking about how to treat healthcare, right? Integrating environmental factors, social factors, emotional, mental issues, and so on and so forth. But also innovative to life science and healthcare companies when they recognize they can't do it all by themselves. They need to, by definition, think about innovative new business models, innovative partnerships, that migration from patient to customer, innovative ways to engage with each other and with the ecosystem and with the regulators. So I think there's an innovation around the delivery of care and the migration from care to well-being. There's also innovation around the different business models and how they engage with other participants.
So we've talked a lot about what this means for traditional industry players, but what's the role with new entrants? Where do you see that in terms of playing in the future of health?
One is that challenging some of the existing orthodoxies, which honestly I believe is very healthy. Because, again, going back to that idea of data and wellness and getting ahead of conditions, we're starting to, in my opinion, finally appreciate that mental, physical, emotional well-being is very important to health, to my ability to recover from a health condition. And I think these other players that are looking at the industry are bringing that mindset of not being rigid in their definition of health or how to treat a condition, but of forcing the life science healthcare companies to think more broadly. Is there a social aspect that needs to be addressed, a home issue that needs to be addressed, an environmental issue that needs to be addressed? What data can we look at to create a more holistic picture of how we can drive to better outcomes? So I think they're appropriately challenging the industry with the ultimate goal, which I think is the Holy Grail, is to get better value for money, reduce costs, improve outcomes.
Whether you're an established incumbent or an emerging player, opportunities abound in the rapidly transforming healthcare industry. But making the most of them will require new mechanisms for identifying and managing risk. Simon, Omri, thanks so much for joining me today on Tales of Transformation.
Thank you.
Stay tuned as we continue our series exploring the journey to the future of health. In our next episode, we'll be diving into some of the biggest digital trends in the industry.